What you have in front of you now is an example of a professionally guided questionnaire. What you're going to notice is that there's more detail here. And this is not the whole thing, this is just part of it. Um, but in a professionally guided questionnaire, somebody is going to sit down with the client and patient. I would assume that would be you as the practitioner. Sit down and walk them through the questionnaire. They might be filling this out themselves, or you might be filling it out for them. So you might be sitting there essentially interviewing them, or they might be sitting there, working through and say, okay, step one, we're going to go through symptoms, look through these. Have you noticed any of these? If they check yes, or they're not sure what something is, then you're there to explain it. Okay. Um, Oftentimes this is done as an interview, but it doesn't have to be. Then you go through current activity. Then you go through specific medical conditions, heart attacks, all the way through renal disease and diabetes. So this clearly, just from a quick visual, you will notice that there's more detail here. Okay, so for your patients who are older, who you perceive for one reason or another to be potentially leaning towards the more unhealthy side of things, this will help give you a better idea of their current medical history. This would not be necessary in those younger, apparently healthy people. Would you do any harm by using this? No, but time is money, right? So if you're taking more time and more resources unnecessarily, that might be inefficient. So each individual facility and each individual case would dictate whether you use a professionally guided or a self-guided, but there's certainly reasons to warrant the use of either one. It's really just going to be a case-by-case scenario.